The College of Rehabilitation Sciences of the University of Santo Tomas contributes to the nation and the world by producing occupational therapists who can competently demonstrate the profession's necessary skills and outcomes. These future occupational therapy professionals are trained using a variety of teaching and learning techniques that take place inside the laboratories and lecture facilities of the college. The Bachelor of Science in Occupational Therapy program utilizes specialized laboratories, a computer laboratory, and common lecture rooms for its students. Occupational Therapy Facilities, Laboratories. The Human Occupational Science Laboratory has adequate equipment and materials needed for evaluation and intervention of the different areas of occupation, such as activities of daily living, instrumental activities of daily living, work, education, play, and leisure. It is specifically designed to facilitate the improvement of the students' therapeutic skills and clinical reasoning through comprehensive and contextualized training activities. These activities may include simulation of techniques and actual demonstrations of strategies significant for entry-level clinical practice in geriatric, pediatric, and psychosocial settings. Occupational therapists use different modalities in order to support a client's occupational performance. The Human Occupational Science or HOCSI laboratory is well equipped with various modalities to improve joint range of motion, muscle strength, and physical endurance. Students are taught how each modality can be an effective tool to regain function, which is the overarching end for any OT service delivery. Guided practice and return demonstrations are some of the teaching, learning activities utilized during the laboratory session. Assistive devices or adaptive devices are one of the occupational therapy intervention tools that support daily occupational performance. Depending on the evaluation results, occupational therapists provide recommendations that will enable a client to engage in desired occupations. In this demonstration, the faculty member shows how to use assistive devices, adaptive devices, used in dressing and feeding in order to maximize the client's participation in these occupations. Lectures, case discussions, demonstrations, as well as giving due consideration to various pragmatic factors that may affect selection and client training are utilized in order to facilitate students' experiential learning. Functional mobility is one of the activities of daily living that occupational therapists also address. This includes wheelchair mobility and transfers. In order to perform it properly, students must, at the minimum, have the foundation knowledge and skills on wheelchair components, different transfers, level of assistance, and body mechanics. To properly execute this skill, the faculty member provides demonstrations on how to perform wheelchair transfers safely and properly. Other teaching learning activities include lectures and case discussions so that students will be well versed with a multitude of clinical scenarios that they may manage in the future. Safe transfers from bed to toilet is also an important skill that students must be able to demonstrate. This requires use of transfer aids, devices, or equipment to ensure that the transfer is done safely both for the client and the occupational therapist. The faculty member shows how to transfer from bed to toilet safely and efficiently while taking into consideration the instructions and assistance provided to the client, the timing, body mechanics, and the use of transfer aids or devices. Students are also provided lectures and case discussions in order to facilitate clinical reasoning and experiential learning. Activities of daily living and fine motor skills are fundamental areas that an occupational therapist teaches in pediatric practice. To ensure that the students are equipped with the competencies needed to facilitate the child's self-care and fine motor skills, the faculty member gives a live demonstration that simulates an actual session. Students are also given ample opportunities to practice skills related to giving instructions, utilizing appropriate attitudes, and gradating activity demands with the guidance of the faculty member. Play is an essential domain when working with children and their families. It is both a means and an end in the pediatric setting. Through well-designed laboratory activities, students actively learn the art of being playful, creative, and resourceful. Equally important, the student's ability to choose the right toy and plan a context-focused intervention to enable the child's play participation is harnessed during the laboratory sessions. Students are trained with different techniques to address the sensory issues affecting a child's ability to participate in meaningful occupations. The Human Occupational Science Laboratory is equipped with various sensory modalities that the students can use and practice on. Demonstrations, feedback, and small group discussions are utilized during the laboratory sessions to enrich the students' learning experience. Gross motor and cognitive skills are an important focus in the field of pediatric occupational therapy. Through interactive discussions, demonstrations, and simulations, students learn how to teach age-appropriate gross motor and cognitive skills in order to maximize play, education, and social participation, among others. Different learning modalities such as sorting shapes, trampoline, and river stones are used during laboratory sessions to enable learning through experience. The program has adequate facilities, equipment, and supplies to conduct various splinting activities. Our teaching learning activities include lectures on the rationale behind splints and how they support participation in occupations, demonstrations on how to fabricate various types of splints across developmental stages, case discussions that facilitate clinical reasoning behind splint prescription and fabrication, and opportunities for hands-on fabrication of splints for various conditions. The Occupational Therapy Kitchen hones the students' clinical skills in the occupational areas of instrumental activities of daily living, leisure participation, and work. It has a variety of equipment, tools, and materials that can be used for actual demonstration of skills and techniques. It promotes hands-on and intensive training while encouraging students to ask questions, to perform return demonstration, and to analyze activities and occupations. Instrumental activities of daily living is one of the areas of occupation in occupational therapy practice. As defined by Occupational Therapy Practice Framework 4th edition, IADL involves activities supporting daily life within the home and community, and one of the occupations under IADL is meal preparation. The faculty member conducts a meal preparation activity for clients with cognitive deficits. Students are taught how to adapt and gradate activity depending on the client's skills and goals. This simple meal preparation activity enables a client to still perform this meaningful occupation through the well-thought-out adaptation of the steps and modification of the tools and materials needed by occupational therapists. Occupational therapy intervention employs a client-centered approach throughout the OT process. Students are taught the significance of letting clients participate in meaningful occupations despite limitations and impairments. Leisure participation is another area of occupation in OT. The faculty member provides a gardening activity for a stroke client while weight-bearing on one hand in a standing position. Students are taught about specific accommodations and modifications to improve client skills while ensuring client safety when engaging in leisure activity. Occupational therapy facilities, laboratories, classrooms, lecture halls common with physical therapy department. Located in the first floor of the central laboratory, the anatomy laboratory allows first-year students to have a hands-on dissection of cadavers in preparation for their practical exams. Human anatomy models and virtual applications are also integrated into the teaching and learning activities of the students. To aid in effective teaching and learning, all classrooms are adequately equipped with technological aids such as portable computers, LCD projector, and audio-visual system. Adequate seating capacity, lighting, and ventilation are conducive to learning. Internet connection inside the classrooms is available upon request. These learning spaces allow flexible arrangements which support collaborative learning essential to achieve learning outcomes. The Center for Health Research and Movement Science serves as the research unit of the College of Rehabilitation Sciences. All research activities initiated and developed in the college are coursed through the CHRMS. Its research projects focus on assessment and interventions to improve health, fitness, and quality of life for different patient and client populations. These studies were previously carried out at the Center for Research on Movement Science, or CRMS, now known as CHRMS. The CHRMS serves as the research unit of the University of Santo Tomas College of Rehabilitation Sciences. CHRMS develops all research activities initiated in UST CRS. CHRMS research projects focus on assessment and interventions to improve health, fitness, and quality of life for different patient and client populations. To ensure the ethical conduct of research undertakings in the college, including those performed by its students, the College of Rehabilitation Sciences has the Ethics Review Committee, which reviews all research proposals from the faculty and students of the College of Rehabilitation Sciences for scientific, technical, and ethical soundness in order to protect the rights and safety of humans in research by upholding the principles of health, research ethics, and good clinical practice. For CRS student research, the UST CRS ERC coordinates directly with the research writing coordinators of the respective department on matters pertaining to ethics review of protocols. The committee shares the first floor office space with the Center for Health Research and Movement Science. The smooth operations of the college and its programs are overseen by the officials and staff in the administration office, located in the second floor of the San Martin de Porres building. The administration offices include the offices of the Dean, Regent, Assistant Dean, and the College Secretary, and have workstations for the office clerks. There's also a receiving area for guests and a mimeographing room. 2 faculty lounges are used by the faculty members from all 4 programs of the college. These faculty rooms are located in the second floor of the San Martin de Porres building and in the central laboratory. The department chairs have their workstations in the San Martin de Porres Building Faculty Lounge. The mental wellness and career needs of the students are under the care of the Counseling and Career Center, which established a satellite office in the College of Rehabilitation Sciences. The Guidance Counselor's Office, located in the 6th floor of the UST Hospital and accessible from the San Martin de Porres Building, provides a safe and secure space for the counselor to conduct one-on-one and small group conferences with learners. A branch of the university-wide Miguel de Benavides Library, the Health Sciences Library is found at the 4th floor of the San Martin de Porres Building. This library serves primarily the needs of the students of the Faculty of Medicine and Surgery, College of Nursing, and College of Rehabilitation Sciences, faculty members, alumni of UST, and off-campus researchers. Located on the 1st floor of the San Martin de Porres Building is the College Computer Barn, which houses workstations and equipment for serious faculty members and students to address their computer technology needs. The movable desks and chairs allow flexibility in terms of groupings, fostering better collaboration among users. The computer barn has a cubicle for the computer laboratory technician who provides technical support to users and ensures the maintenance of the facilities and equipment.